asked to write this, and we were looking at the results that others had put out there about the ICU experience of post-traumatic stress symptomatology, depression, anxiety. And we looked at some of the driving causes that had been identified already in the literature. And when we considered what these causes were discussing, it came to us that, you know, it really brought us back to Maslow's hierarchy of needs. Now, Maslow's hierarchy of needs identifies some essential needs that every human has in order to move forward without having a psychological, negative psychological impacts in their lives. And he identified these back in the 1950s and talked about physiological needs, safety needs, the need to have love and belonging in our lives, the needs for esteem, and finally, the last need, the need for self-fulfillment. Now, self-fulfillment is one that, you know, may go to our state of happiness, but doesn't necessarily cause psychological harms if unmet in our estimation. However, physiologic needs, if we start with that, you know, the basic ability for self-care, time to have a break, to go to a washroom during the day when patients are piling in, and to have somebody sort of spell you off so that you can rehydrate when you're in all those layers of PPE and behind the mask. Those needs are very important. And I think it identifies how we have some lapses in how we've previously structured teams, because, you know, we've all had days where it's been hard to eat, hard to drink, but now we have many more of those days. And unless we look at how our workflow it's really hard for us to maintain our physiologic needs and our own, you know, sort of basic needs as human beings for us to be able to provide care to others. The issue of safety. I think when the pandemic first started, you know, we had all of these issues around the world about PPE, its effectiveness, is it droplet, is it airborne? You know, now there's been increasing evidence that there's an airborne component to this. And, you know, what I'd like to see is more transparency about what that means in terms of our PPE. Something like Elizabeth's cockpit, having updated information as information evolves. The same for vaccines. While many of us have been vaccinated, our families have not. And we know that efficacy of vaccines are going to change as the virus mutates further. So, you know, update scientific papers. Where's the evidence coming from that claims that the vaccines are still effective? I think we're all science-based, and, you know, to have an attitude that just says, trust me, you know, this vaccine is fine, or without providing incidents of side effects and reference points is really hard for people to keep moving and feeling safe while they do so and keeping their families safe at home. Things like outbreaks that happen. You know, what were the driving forces of the outbreak? How did it happen if we were all so safe in the current PPE? I think transmitting that information organization-wide as we evolve is also very important. And yet, you know, these are things that we've never had to really deal with on such a large scale before, that are important to consider as we move forward in these ongoing waves of this pandemic. You know, things that are important should not be imposed. So for example, you know, saying that you're going to have somebody come into the ICU to fulfill certain roles, even if it's communication and helping with communicate with families, asking the ICU team, how would that work from your perspective? What would make it work? Where do you anticipate the difficulties, rather than saying we're bringing people in, is also a very important thing in terms of, you know, both safety and maintaining patient safety and family safety, but also not increasing the workload inadvertently through a desire to help. The idea of belonging. I think a lot of people, you know, we need to feel supported within the team. I think we're very good, as I pointed out in that article, of conveying support to families. We're not maybe so good at conveying support among ourselves as team, understanding that it's okay to need support, understanding that different people are going to be at different places at different times. You know, you're going to have strengths at sometimes and less resilience at others, and that is okay. You know, an acceptance of that amongst the team, and helping each other when we're not so strong, that's not a sign of weakness, right? And that should never be seen as a sign of weakness. And that needs to be continuously communicated as we move forward. You know, and the idea of you know, esteem, of being valued as a field that is really very much on the front lines. You know, in a recent interview, some of my colleagues called us the last line of defense, not the front lines anymore. I think means the organizations need to ask us, right? But I also think that if we look to the organizations to be valued or to obtain our own sense of inner value, we're looking in the wrong place. You know, we need to understand who we are and what we bring and the value that that has in and of itself. You can't always look for others on the outside to convey that they value you. But if an organization is going to try to commit to an expression that, you know, thank you, then make sure it's meaningful. You know, and part of that meaningfulness means to recognize the unique contributions. You know, whether it's having that space that Elizabeth like outlines so well of respite, a place where there's green things that live, you know, something that allows us to go outside. That is much more valued than having a pin that says thank you to the healthcare heroes, you know, which doesn't convey the same kind of messaging. It doesn't bring it into enough depth. And finally, I think, you know, the last piece I want to emphasize, because I don't think it's received enough attention, we are not just professionals, we are people, right? Everybody talks about the worry about bringing the virus home, you know, of getting their family vaccinated, and those concerns are very, very real. But it's also what else we bring home in terms of the emotional toll and the fatigue and how we talk about that and not exclude the people who care for us from our lives. And I think, you know, in terms of some of the help that we need is to understand how to do that without turning your family into your counselor, but at the same time, not shutting them out of a very big moment that we're all living and all of the effort and emotions that go into that. Because when you care for somebody, you care for the whole person. And I described and I referenced one of the articles that I think is really meaningful from Vox, which is written by a family member of an ICU worker. And I encourage you all to read it because I think the words in that are very, very powerful, and it brings home the dangers that we face by not figuring this out. Because, you know, to lose your family in the midst of this is a very big price to pay, and it's one that no one should have to pay.